The number one problem in abuse is denial. The number one problem in abuse is denial. Definition: refusal to accept the reality of their problem. How do you treat it? Treating denial. Confront it by pointing out to the person the difference between what they say and what they do. All right, so denial. I'm not an alcoholic. I just really like to drink red wine. Look, I got a difficult life. Do you realize how hard I work? I work so hard. All I want to do is go home and have a glass of red wine. Really? What's the problem with that? I mean, what are you going to say to that, right? I mean, if that's really all it is, okay, sure, go ahead home and have a glass of red wine. But if we really think they're alcoholics, we know it's more than that, right? So they're refusing to accept the reality of their problem. So that's the denial, right? I'm not really I don't abuse my wife. We just have a really physical relationship, okay? That's denial. So how do we deal with that? We confront it. You say you're not an alcoholic, but you have 3 DUIs and you've lost your license for 2 years. Do you see how I'm pointing out reality? They cannot argue with reality. You have 3 DUIs and you've lost your license for 2 years. See, that's not the kind of thing that happens to people who just like to have a glass of red wine every once in a while. They don't get 3 DUIs and lose their license for 2 years. That kind of thing happens to an alcoholic. So remember, confrontation is a good thing in psych. Confrontation is a good thing in psych. It's not aggression. It's not anger. It's not discipline. It's presenting reality. And it's not an if you don't do this, then this will happen. If then is bad. Don't ever do if then in psych. So you're not saying, well, if you don't stop drinking, you're going to have liver failure. That's if then. That's not reality. That's saying something could happen in the future, and you can never predict the future. You don't know what's going to happen in the future. You're presenting the reality of today. You have 3 DUIs and you've lost your license. That's today this happens. And what you don't say is, well, how do I know they have 3 DUIs and they lost their license for 2 years? You're overthinking. The hardest thing for me to deal with as an NCLEX tutor is someone who overthinks, because people who overthink have a lot of trouble stopping that. And even when I say to them, you're overthinking, they're like, but. So here's how you know if you're overthinking. You're using these words in your thought processes. If, maybe, could, possibly. If you're using those words in your thought processes, you are overthinking. But maybe, well, it could be, but if you're using those words in your thought processes, you are overthinking, and you have to stop. And you have to stop arguing about it. You just have to say, I need to stop. I'm not teaching you how to be a nurse, y'all. I'm teaching you how to pass a test. You only know the information that they tell you. So if they say to you, what you're taking care of patients, an alcoholic, they say to you, I'm not an alcoholic. I just really like to drink red wine. What is your best response? And one of the answers is, you say you're not an alcoholic, but you've had 3 DUIs and you've lost your license for 2 years. What you say is, I know I need to confront the patient. Is this an example of confrontation? Yes or no? Is this an example of confrontation? Yes or no? Yes? Then I'm going to pick it. I'm not going to go, but how? But what? But me? No. Stop it. is this an example of confrontation? Yes, then I'm going to pick it. Don't say, but I would never say that. I don't care if you'd never say that. Is an example of confrontation? Yes, then pick it. All right. In contrast, B, in contrast, we didn't fill in the last blank. Did you notice that? Nobody asked me about it. You're getting good. You're getting good. You know, I'm going to get there. In contrast, support the denial of loss and grief. Support the denial of loss and grief. So I don't know if you've heard of Kubler-Ross. Kubler-Ross was a theorist. I think it was a woman. I'm not sure, who kind of did a lot of observations for people going through loss and grief. And they said, you know, there's these stages that everybody has to go through, and denial is one of those stages. So let's say you're going to visit someone in home care. You have a home care visit with an 85-year-old gentleman who recently lost his wife of 65 years. They were married for 65 years. He recently lost her. And you get there and he says, oh, it just seems like my wife is going to walk in the door any minute. I think, you know, it just seems like she is. And he doesn't, he's sort of in, really seems to be in denial. Like he's not crying or anything. He's just like he's waiting for her. Here's what you don't do. You don't say, it seems like your wife is going to walk in the door any minute, but do you remember you went to her funeral 2 weeks ago? That's what you don't say. Okay, because denial is one of the stages of loss and grief. So you don't have to confront it. You just have to support it. So that doesn't mean you have to buy into it. You don't have to say, oh yeah, I'm sure it seems like she'd walk in any minute. But what you can say is, well, tell me more about your wife. Tell me more about how you're feeling, right? Just ask some nice therapeutic, open-ended question. Maybe you can show empathy. You know, it must be really difficult without her here. Something like that, but you don't have to confront it. That's what you don't have to do, okay? So we support denial in loss and grief. I don't know if you'll get a question like that, but if you do, you don't confront it. All right, let's talk about dependency and codependency. Dependency is when the abuser, and the abuser is the person who's abusing alcohol or drugs or whatever, when the abuser gets the significant others to do things for them or make decisions for them. Codependency is when the significant other derives positive self-esteem from doing things or making decisions for the abuser. Go to page 5. Let's talk about treating dependency and codependency. All right, treating dependency and codependency. Set limits and enforce them. Agree in advance on what requests are allowed, then enforce the agreement and work on the self-esteem of the codependent person. Now, there's no blanks to fill in right this minute. I'm just going to talk just a little bit about this idea of dependency and codependency, just so it makes sense to you, because it's just so common, this idea of dependency and codependency. So I don't know if you've ever watched the show Intervention. I think it's on A&E or something like that. It's Intervention. It's usually a family that you don't really need to see that anymore. So it's usually a family that calls in. They say, we have a family member who's addicted to fentanyl. We're afraid that they're going to just, maybe meth. Let's do meth. They're addicted to meth, and we're afraid they're going to die if we don't intervene, and we don't know what to do. And so they send out an interventionist, right? And they set up an intervention. And what happens is the interventionist gets together with the family members. Usually it's grandma, mom and dad. Mom and dad may be divorced or married. A lot of times they're divorced, couple siblings, and maybe a friend. And they say, so what you need, so the interventionist is talking to the family, and they say to the family, you need to set limits, okay? So you need to say, if you don't stop this behavior, this is what I will do. And it has to be something that is significant for them. So maybe mom has been letting Jimmy sleep in the basement because Jimmy doesn't have anywhere else to live. And so Jimmy's been living in the basement rent free. And so mom might say, if you don't stop this behavior, you're going to have to move out. You'll no longer be allowed to live here. And maybe grandma's been giving Jimmy money because grandma just loves Jimmy so much. He was her favorite grandson. Maybe he's her only grandson. And she just loves him so much. She's been giving him money because she's just afraid that he's just going to die. And so grandma says, if you don't stop this behavior, I'm going to stop giving you money. And the sister maybe is getting really fed up with him, but she's been driving him for his pickups. He tells her, if I don't get this, I feel terrible. You don't understand how bad I feel. I just need to go get it. Can't you drive me? I don't have my license anymore. And finally, the sister says, fine, I'll take you. So the sister drives him. And so the sister says, if you don't stop this behavior, I'm not going to drive you anywhere anymore. Right. And so they all set limits. And you always think it's never going to work because like they're following this person around, this person who's addicted to meth, and they're like super addicted, and they're talking about how they wish they could stop, but they never been able to, and they don't think they'll ever be able to, and da 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 da, and they're totally dependent on it. And so then they bring him in for this intervention. You think there's no way he's going to stop, and the family is kind of like, I don't think this is going to work. But what we don't understand in watching it is that the abuser is completely dependent on these 5 people in the room with him. There is no one else in this abuser's life but these 5 people. If the abuser doesn't have these 5 people, they've got nobody. Literally, everybody else has abandoned them because they've gotten so sick and tired of being manipulated and used because of their abuse, right? So the only people they got left is mom, dad, grandma, sister, and maybe this friend. That's it. They got nobody. If these people let them down. So they come in and they're rolling their eyes. Oh, I can't believe you got me in here. Why'd you lie to me? I don't want to be here. And so then maybe grandma reads her thing and she's like, this is how your abuse makes me feel. And if you don't stop doing this, I'm not going to give you any money anymore. And the abuser's like, yeah, fine, whatever, grandma, no big deal. And then mom says, okay, this is how what you're doing makes me feel. And if you don't stop doing this, then you're going to have to move out of the house. And the abuser's kind of is quieter and is like, okay. And then the sister says, and this is how your abuse makes me feel. And if you don't stop doing this, I'm not going to drive you anymore. And by the time you get to the last person, the abuser realizes that if he doesn't go to rehab, if he doesn't take the opportunity to go to rehab now and stop this behavior, he will have nobody in his life. He is completely dependent on these 5 people. That's what dependency is. The people don't enjoy being dependent on. They don't want to, they're not trying to enable this dude. But they love him and they're afraid if I don't do this, he's going to end up dead on the street somewhere. And he is completely dependent on these 5 people. And what he realizes at the end of that intervention is he will be completely alone. For the first time ever, he's facing the possibility of completely alone in the world. He's got no resources. He's got no skills. He's completely addicted. And he says, fine, I'll go to rehab. And we're all surprised at the end. Oh, I can't believe he went to rehab. I didn't think he was going to go. But they almost always do. And if they don't, do you know what happens? The family enforce the limits they just set. I'm sorry, I didn't set the limit again. If the family enforces the limits they just set, that person will be going to rehab within a week. Because they've got nowhere to go, they've got no money, they've got no car, they got nothing. And if the family's actually willing to enforce it, that person will be in rehab within the week. So that's why those interventions always work. Now, rehab isn't always successful. But if the families stick by their limits, if rehab isn't successful, a lot of times they'll go back again. But the family has to really stick by it. All right, well, that's dependency, codependency. Now, codependency is the big problem. If they have a codependent partner, it's much, much more difficult to get them to go to rehab because the codependent partners never end on the intervention. They don't really want them to stop. A lot of times it's a romantic or sexual partner who is providing the substance for them in exchange for sex or in exchange for companionship or whatever it is. And they don't actually want the person to change. So when there's a codependent partner, it's very, very difficult to get someone to actually stop their abusive behavior. All right, let's keep going. Manipulation. When the abuser gets a significant other to do things for him or her that aren't in the best interest of the significant other, the nature of the act is dangerous or harmful, to the significant other. Now, this is different than we use the word manipulation in everyday parlance. And I mean, it's similar, has a very similar meaning. It's getting you to do something you don't necessarily want to do. But in a psych setting, manipulation has to have a harm component. It doesn't have to be physically harmful, but emotionally harmful or maybe illegal. You know, if an alcoholic is getting their underage child to buy alcohol for them, that's illegal, right? That's manipulation. So there has to be some component of harm in a psych setting for it to be considered manipulation. Treating manipulation, we set limits and enforce them. It's easier to treat manipulation than dependency, codependency, because no one likes to be manipulated. All right, let's talk about Wernicke-Korsakoff. Wernicke-Korsakoff, there's no blank for this, but I want you to write this word down. There's no blank for it, dementia. Wernicke-Korsakoff is a type or a form of dementia. Now, the reason I want you to remember that is because everybody knows a little something about dementia. Like even if you're not a nurse, everybody knows a little something about dementia. So is dementia, let me ask you this, is dementia reversible? Like if you develop dementia, is it going to get, what's the type of dementia everybody knows about? Allie, do you know what type of dementia is the most common? No, yeah, I didn't do my job. Alzheimer's. Have you heard of Alzheimer's? Yes, you have. Okay. So Alzheimer's is probably the most common type of dementia everybody's heard of. So if I said someone gets Alzheimer's, are they going to get better? Is it going to reverse? Allie, is it going to reverse? Does Alzheimer's get better? No. Okay. So everybody knows that. Everybody knows once you get Alzheimer's, you've got it. It's not reversible, right? What else do we know about dementia? Well, there's confusion, certainly confusion, but there's also psychosis. We don't talk about it that way a lot. But have you ever taken care of someone with Alzheimer's and they're talking to people who aren't there? Or cute little lady, day shift nurse is like, oh, she was no problem all day. She was just pleasantly confused. And then in the middle of the night, she's yelling, Harold, Harold. And you're like, who are you yelling at? I'm yelling at Harold. Well, who's Harold? He's my husband. Well, why are you yelling at him? He's out in the hall. Get him in here. I can hear him out there. Harold. Harold's not out there. Now, maybe she's hearing voices. She may actually be hearing voices, like maybe the nurse is talking out there and she thinks it's Harold, but it's not Harold, but she's certain Harold's out there, right? So that's psychosis right there. So, or maybe they hear cats meowing in the corner, like there's no cats meowing in the corner, right? So Wernicke-Korsakoff is a type of dementia. That means there's this kind of psychosis confusion component to it. And once they develop it, y'all, it does not get any better. They can get it, stop it from getting worse, but they can't ever reverse it. So what is Wernicke-Korsakoff? Wernicke-Korsakoff, now we're going to fill in the blanks. It is a psychosis induced by vitamin B1, which is thiamine, deficiency. The primary symptom is amnesia with confabulation. So I'm going to just briefly describe psychosis to you. We have an entire lecture tomorrow on psychosis called Delusions, Hallucinations, and Illusions. Okay, that's, I think that's the name of it. Anyway, we have an entire lecture on it tomorrow. So I'm not going to spend a lot of time on it. So you don't have to write this down now, but psychosis is delusions, hallucinations, and illusions. That's what it is, right? So they're seeing things that aren't there. They're hearing things that aren't there. They believe things that aren't true. A lot of times they're real paranoid. They think you're trying to hurt them or kill them or kidnap them or something like that, right? So that's psychosis. So they develop a psychosis. So they're seeing things that aren't there, hearing things that aren't there, believing things that aren't true, associated with vitamin B1 deficiency. Now, the interesting thing about vitamin B1 or thiamine is it is used to store memory. thiamine is used to store memory. So it is also metabolized. It is used to metabolize alcohol. Thiamine is used to store memory, and thiamine is used to metabolize or break down alcohol. So have you ever heard of the phrase blackout drunk? So blackout drunk does not mean they passed out. Now they might have passed out, but that's not what it means. Blackout drunk means they have no memory of what happened while they were drunk. And the reason that happens is because they use up all their thiamine in metabolism. Usually it's from binge drinking, and they've used up all the thiamine with their alcohol, and so they don't store any of the memories. So they literally have no memory of what happened because they didn't store any of those memories. So that's blackout drunk. So what happens when people are alcoholics? See, people who are alcoholics have to maintain a certain level of alcohol in their body at all times, or they start to experience withdrawal. Now, they've developed a tolerance to it, so they don't feel drunk. If you check their blood alcohol level, their blood alcohol level would probably be high enough to be considered intoxicated, but they don't feel like it because they've developed a tolerance to it, okay? But they have this constant level of alcohol in their body, and so they're constantly using up all their thiamine. So they have very poor memory. If you know anyone who abuses alcohol, they have very, very poor memories. They can remember almost nothing. College-age kids who are binge drinking a lot on the weekends, they struggle in school. It's because they can't remember anything. I mean, they may study, but they can't remember anything because they just have such poor memories from all the binge drinking. So knowing that, think about this. Someone's an alcoholic, drinking a lot. What happens is they develop this type of alcohol-induced dementia, and it's called Wernicke-Korsakoff. And amnesia means a loss of memory. You have no memory, and it's usually from like a huge amount of time, like maybe a decade. Have you ever heard of Steven Tyler? He's the lead singer of, what's the band Steven Tyler is the lead singer for? Do you know, Allie? What is the name of the Steven Tyler? Anybody want to tell me in the chat? What band is Steven Tyler the head singer? Aerosmith. You're right. Thank you. Aerosmith. Okay. So Steven Tyler will talk about, I can't remember anything that happened back in the 70s. We were having so much fun partying in the 70s and 80s. I don't remember anything that happened. All right. He's not kidding, y'all. He can't remember anything that happened in the 70s and the 80s. I mean, he'll laugh about it now, but he can't remember it. It doesn't mean he has Wernicke-Korsakoff's, but he didn't store any of the memories from during those years while he was drinking so much. So you can have no memories doesn't mean that you have Wernicke-Korsakoff. This is amnesia with confabulation. So it's not just amnesia, it's amnesia with confabulation. Confabulation are memories that weren't real. So believing things that aren't true is called a delusion. So they develop delusions. It's called confabulation. It's amnesia with confabulation. They start to believe things happen that didn't really happen. I call these people old alcoholics. I've worked cardiac step down for many, many, many years. And so we get all the alcohol withdrawal patients on our floor. And you'll know a little more about that why when we talk about withdrawal. Nevertheless, we get all these old alcoholics on our floor. And they're some of the nicest people in the world. They really are. They're very nice, very down to earth, no judgment, just whatever, love everybody. Okay, fine. But they tell some crazy stories. They'll start talking. And they're talking to you and they're telling you some story about like something they did like 25 years ago. And you're like, really? That doesn't, really? You did that? Like you climbed Mount Kilimanjaro in East Africa? Like, really? Like, it just doesn't make any sense what they're telling you. And they just so many crazy stories. I'm like, I had 10 miscarriages when I was 24, and I been divorced 5 times, and I've had 3 husbands, and they've all cheated on me, and they cheated on me with my mom, right? And they're telling you crazy stories, not just like one, but like crazy stories, and you're like, that doesn't sound right. Like there's just something off. So if you're taking care of old alcoholics and they're telling you crazy stories, they may have Wernicke-Korsakoff. Now remember, it's not reversible, but it does get worse if they don't quit drinking. So early on, they're kind of like telling crazy stories, and as they go, they get more and more and more confused, and they start wandering the hall just like anybody else with dementia would. Okay, and they're like not sure where they are and stuff. So it does kind of progress. as they go. But Wernicke-Korsakoff is psychosis induced by vitamin B1 deficiency. The primary symptom is amnesia with confabulation. The characteristics are that it is irreversible, it is arrestable, and it is preventable. How do you think we can prevent it? Other than not drinking. Other than not drinking, how can we prevent it? By taking thiamine every day. I always say to my alcoholic patients, look, you need to stop drinking, but if you're not going to do that, at least you need to take your daily thiamine. At the very least, you got to do that. So thiamine is something every alcoholic is going to receive a prescription for. You can take it without a prescription, but prescription allows insurance to pay for it. Really? Are you, Janet, you're from Tanzania? Kilimanjaro? My parents actually climbed Mount Kilimanjaro back in the 60s. That's why I said that. But they got a lot of crazy stories. You might think my parents were Wernicke-Korsakoff if you ever talk to them, but they're not. Okay, let's move on to page 6. Wow, Janet, you're in Tanzania. Are you here in the United States? I go to Malawi every year. I'm going to Malawi in about 2 months. That's close to your home. Anyway, I can't get distracted by Tanzania stories, y'all. I got to keep going. All right, page 6, disulfiram naltrexone. These are called aversion therapy. Aversion therapy, okay? Aversion therapy, because they're medications that make you not want to drink at all. The onset and duration of effectiveness is 2 weeks, which means you have to be on it for 2 weeks before it starts to work, and you have to be off of it for 2 weeks before it's completely out of your system. So that means you have to be off these meds for at least 2 weeks before it's safe to drink again if you decide to drink. So the patient teaching is avoid all forms of alcohol to avoid life-threatening vomiting. To avoid life-threatening vomiting. And we're not just talking about like, oh, I feel nauseated, or oh, I threw up like 3 times. We're talking about life-threatening vomiting. Remember we talked about acid-base imbalance? And we said severe prolonged vomiting causes what acid-base imbalance? Metabolic alkalosis. That's why it's life-threatening, y'all. Such severe vomiting, they can die from it. Acid-base imbalance, electrolyte imbalance, fluid imbalance. If you know someone who takes disulfiram and they accidentally ingest alcohol, they need to go to the ED or the urgent care. They need an IV because they could die from this, okay? And it's not just drinking alcohol. Alcohol can be absorbed through the skin. So you have to do really important teaching. Obviously, they cannot drink alcohol. Like, okay, of course they can't drink alcohol, but here's all the other stuff they also have to avoid, okay? Here's all the other stuff they also have to avoid. I got to make sure I know I'll get most of them, but I cannot trust my memory 100% today. All right. Okay, so you have to avoid alcohol. This is A. Alcohol prep pads, because it's absorbed through the skin. You have to avoid aftershave. You remember Home Alone? Anybody watch Home Alone at Christmas time? I always like to watch that movie at Christmas time. And that kind of front cover, kind of that iconic picture of Macaulay Culkin where he's got his hands on his cheek going, like that. You remember that? Well, that's because he was shaving with his dad's razor, only he didn't use any shaving cream. He just like, remember the first time you shaved? I know you remember the first time you shaved because I remember the first time I shaved. And I did it dry with no water, no shaving cream, nothing. I was just like, oh, I feel a little hair on my legs. I think I'm going to shave it. And you got that horrible shave burn, right? That you got because you didn't use anything. That's what Macaulay Culkin did in Home Alone, right? He shaved and then he put his dad's aftershave on it and it burned. He went, because why? Because there's alcohol in aftershave. Okay. So aftershave, insect repellents, vanilla extract. Now, if it's cooked, you don't have to worry about it. But there's a lot of stuff we put vanilla extract in. Excuse me. We put a lot of vanilla extract in a lot of stuff that's not cooked, like frostings. Particularly one of the things is like frostings, different kinds of things we drizzle over things, right? It may have vanilla extract in it. It was never cooked. Oops. Alcohol-based hand rubs. Which is what we call hand sanitizer. So whenever you see the word alcohol-based hand rub on the NCLEX, switch it to hand sanitizer. Whenever I see alcohol-based hand rub, it throws my brain just like, it like screeches to a halt. Because I'm like, what is that? So just change it to the word hand sanitizer so it doesn't throw you off. Vinaigrettes, which are salad dressings. Elixirs, which are liquid medications. All over-the-counter liquid medications are in an alcohol-based liquid. So all the cold medicines, Robitussin, NyQuil, all the generic equivalents of all that stuff, anything that's liquid over the counter is in an alcohol-based, you should assume it's an alcohol-based solution, and they cannot take that. Perfumes and colognes. And mouthwash. All have alcohol. So those are all out. None of those. All right, next page, page 7. Yeah, I feel like I'm getting pages stuck together here. Let me see what questions we have. Brenda said, can you elaborate on arrestable? Arrestable means stop it from getting any worse. So if someone has Wernicke's and they start taking thiamine and maybe they're at the stage where they're just still, they're kind of eccentric, but not completely confused yet, they won't get any worse. Is a prescription needed for thiamine? You can know foods high in thiamine, I guess, but usually we just would tell them to take, you can buy it over the counter or they can get a prescription for it. You can get it without a prescription. All right. Oh, wow, you live there. Oh, y'all. Okay, I don't want to get, she said, what about red wine vinaigrettes? All right, so I don't want to get bogged down with this. Here's the thing. There are exceptions to every rule. There are exceptions to every rule, but the NCLEX focuses on general principles. If there's one, let's say red wine vinaigrette is an exception to the rule of alcohol. You don't need to know it. They're not going to ask you about it. They test on general principles, not exceptions. There are a few exceptions you need to know. We do try to make sure you know those, but generally speaking, you don't need to know all the exceptions. You need to know the rules, okay? So I don't want to get bogged down with exceptions.